This is In Step with Compliance, a podcast by the Modern Practice Solutions team for dental professionals.
Welcome to In Step with Compliance, produced by Modern Practice Solutions. I'm Olivia Wan, your host. In this episode, we will be interviewing Brenda Thornburg. Brenda works with Modern Practice Solutions as a compliance trainer and has the opportunity to consult hundreds of dental offices about their HIPAA compliance program. So we thought it would be very appropriate to interview Brenda and get her insight on what the top 10 HIPAA violations are. So Brenda, let's get started. What can you tell us as probably one of the number one complaints that you see as it relates to HIPAA compliance?
One of the top 10 for sure is snooping of healthcare records. So when team members or another entity snoop on healthcare records of families, friends, neighbors, coworkers, or even celebrities, it's one of the most common HIPAA violations committed by employees.
So it seems like that would probably be more common in hospital settings. Matter of fact, Brenda, I had a support call years ago from a non-client where the individual worked for a hospital, and she was called into the HIPAA security department because she was accessing her stepchildren's medical records without authorization. So she was actually a provider in the hospital setting, but based on what the children's medical history was, she should not have had access to it. So I don't know that she realized that they could tell based on the audit trails which files were being accessed. So she was actually dismissed from her job for snooping into records that she had no authorization. So Caitlin, what's your thought? I mean, this might be a bigger problem in hospital settings or larger clinics. When you work on site with clients, have you ever seen this to come up as a problem?
It's important to remember as a provider that you should only be accessing records for the patients whose treatment you're involved in. And at a small practice, this could be most of the patients. Maybe you see your doctor's patients and you see your hygiene patients as a hygienist. But in a bigger practice like a DSO, you should only be accessing patients perhaps at your location or who are involved in your area of the practice. And that's important to remember. Just because you have access doesn't mean you're authorized necessarily.
That's a good point, Caitlin. So, Brenda, that's good information that we share with our listeners. What else do you see as a HIPAA violation potentially in talking with clients?
I think probably one of the most common in working through their HIPAA requirements with our clients is the failure to perform their risk assessment periodically. That's a big task, and I think the offices are a little bit, they shy away from that a little bit just because it is such a big task. But without performing that periodic risk assessment, you have no way to know if your protected health information or your electronic protected health information is actually being accessed by an outside source or someone who shouldn't have access to it.
So true. So that HIPAA security risk assessment is federal law. It's required that we do it. And I'm like you, Brenda, when I'm working with groups and especially when I'm doing seminars, I try to take a pulse on what the experience is of the attendees. And some may be familiar with it, but they haven't done it. Or like you said, they don't have enough time allocated in their schedule to complete it. And another thought I wanted to supplement, Brenda, is that according to the Office of Civil Rights, the OCR, it has to be a detailed risk assessment. It cannot be a cover page and 2 pages. And that was specifically quoted by the OCR director. It has to be detailed, identifying the vulnerability and potential threats and listing it as low, medium, and high. How many pages would you say, Brenda, when we do a risk assessment, how many pages would you say it is?
Oh my goodness. I would say that's a great question. It's probably about 30 pages.
Mhm.
I don't know if
Yeah.
that's,
I was thinking it was 30, 40 pages.
yeah.
And Caitlin, when we do a HIPAA security risk assessment, what other information are we asking for?
So our security risk assessment looks at technological vulnerabilities in your system and also looks at different practices you may or may not have at your facility to protect that data. So we ask questions like, what technical safeguards do you have in place? For example, firewalls, encrypted email. Are you doing penetration testing? Are you doing vulnerability scanning? All of these things are recommended under HIPAA. Some of them are listed as addressable, some of them are required, and we want to know which of those you are implementing and which you are not. And it's important that if you're not implementing some of these addressable safeguards, you have a good reason why. Why aren't you using encrypted email? And these are questions we want you to think about as you walk through your risk assessment. We also want to know what written policies you have in place. Do your employees understand what their roles and responsibilities are when it comes to privacy and security of that protected health information?
And I was thinking to supplement that thought is the fact that we should be able to demonstrate the recognized security practices. And so, Brenda and Caitlin, too, when you're doing these risk assessments, is the client able to produce what we're asking for? So if we're asking a specific question, like maybe it's, have you identified your business associates? Where are those agreements? Or even an inventory of the IT assets. Because there's a big difference between answering the question as yes, and then can they actually supply it? What are your thoughts there?
Yeah, that's a very good point. And that's where I think quite often our clients don't realize how big of a role their IT companies and support systems play in this part of their HIPAA compliance. They don't often know what some of these questions mean, as Caitlin had alluded to, but that doesn't mean that they can just say, unknown or we don't know. It is actually their requirement to get with their IT company and find out what process is in place. And we certainly do a lot of that for our clients, which is fantastic because we know they're very busy. But yeah, in the end, it's really up to the client to make sure that they understand the questions that are being asked in the risk assessment. And then there's another side to that too. Another very common violation in HIPAA is not only not completing the risk assessment, but actually having a failure to implement any corrections or changes. We are actually required once we know what's out of whack with that risk assessment, we are required to go back through then and work on correcting those issues. And so many offices that I chat with think that when the risk assessment's done, they're free and clear for another year.
Yeah, that's a good point. You have to act on what we've identified. And I believe we have it in our training slide where it states that just because an entity contracts with a service or like an IT professional doesn't relieve them from the accountability. And so if you think your IT person is managing, for example, the inventory of assets and they're not, and you get audited by the OCR, well, it's the entity, the dental practice, that would be responsible for the violation, not the IT professional. And you made a good point that it's failure to manage those security risks. So I know that has to be frustrating, Brenda, if you outline a list of areas to work on and then the following year there's not been any changes. What would be another potential violation that's common?
I can, one that's actually probably more common in the dental office setting is that we come across is denying patients access to their health records. As we know in our training and our conversations, we are required to provide patient records if they are requested and within a specific time frame. And a lot of offices don't realize that the federal guideline is maybe 30 days, but the individual states have their own dates and requirements. Some are as low as 5 days, some are as low as 10. But I think this is one of the more common things that we see with our dental clients is that a patient requested their information, and for whatever reason, the office did not provide that in a timely manner. And that's a very big violation.
So, Brenda, can they withhold the record if they haven't paid their bill?
They cannot. They cannot. And that sometimes I think if you say, well, we're going to charge a fee to provide those records, you can charge a fee to do that as long as it's reasonable. But you cannot deny the records even if the patient has an outstanding balance with you or cannot provide that fee that you're charging.
Right. Good point. And if it's electronic copy, we understand that, according to the OCR, we would not charge a fee. If it's paper
Right.
copies, it's understandable. So this
Right.
could create a big mess. And sometimes I wonder if the request comes in and the envelope is just sitting on the doctor's desk. Nobody's opening it to see that there's been a request made. Or I've had support calls where they're scared to follow through with the request because they're worried that the patient has gone to another dentist because they're not happy with services and maybe there's a risk of malpractice claim. But yeah, the clock is ticking. Do you see any other areas that are vulnerable to violation?
Oh, there are many. Another area that sometimes I think offices are not tuned into is just how long do they need to maintain a copy of a patient's record. Every state has its own laws, again, with regard to that, or most of them do. But you are required to maintain patient records for a certain amount of time, even when they're no longer a patient in your practice. And then the flip side of that is, how do we dispose of electronic patient records or just protected health information that we no longer need to maintain? So we've reached that time frame that we were required to keep it. Now, how do we dispose of it appropriately? So I think a lot of offices don't realize that you cannot just throw a paper chart in the trash. There are specific procedures you need to follow through with. If you have paper copies, you're going to want to shred them and have proof that they were shredded legally. Electronic copies, again, you're going to want to wipe those records clean, and so that there's no record of those before you dispose of any type of computer equipment.
Yeah, good point. So when the computers are outdated, they have to be professionally wiped before retiring them. And, one of the things I like to talk to my seminar groups about is the fact that, let's say that it's a solo practice and there's 2,500 or 3,500 patients of record, and yet there's 20 to 30,000 records in the system. So if there's a security breach and you've got all this old data of patients that are far beyond the state's record retention rules, think about the vulnerability of the practice, because it costs money for breach reporting for all of the affected files. So I wish there was a way that these practice management programs could archive and move out that electronic data so that we're not responsible for tens of thousands of patients that are not even patients any longer. So that might be something to think about. But can you talk to us about business associate agreements?
Yes, and business associate agreements are a very large part of your HIPAA program and documentation. We are required to have a business associates agreement with anyone who may have direct access to our protected health information. So maybe that might be our accountant, or it might be our software program that we're using. It could also be a consultant that we're working with who is in the practice. But basically, the business associates agreement outlines the fact that they do have access to confidential information and that they will not utilize or share that without following the boundaries of their business agreement with us.
Mm-hmm. And it also mentions about, if there's a breach, then they have the obligation to inform the covered entity right away. And I
Yes.
know with the proposed HIPAA security rule changes, they're going to shorten that period. And I know Caitlin was looking at a business associate agreement the other day that a corporate group provided to the dental office. What about like if the corporate group prepares it, can you talk to the difference between being pro dentist versus pro vendor?
Yeah, of course. So the corporate entity may have their own reasons for wording that business associate agreement to be a little bit more favorable for the corporate entity. For example, they would rather the covered entity take on more of the liability associated with this issue. So I, as the dentist, would prefer that agreement to indicate that the business associate is liable for any breach they cause in my system, whereas the corporate entity may prefer that they are completely hands off and whatever happens is the dentist's responsibility. So it's really important to read those carefully and perhaps have your attorney review them if you're concerned. We don't want to sign an agreement that's unfavorable when we have the option.
Exactly. And we've seen agreements like that where they totally disclaimed any responsibility for a breach, even if the breach was their responsibility because they caused it. And that would be a concern in gathering them. Brenda, what can you speak to as it relates to access controls?
Well, we as a profession, we do need to have in place a system to control who has access to our information. So not only with our team members, should team members be granted access across the board? No. Different team members have different reasons to access different types of information within the system. So your front office team or your practice manager may have a completely different level of access to the information than, say, a sterilization technician. But not just with our team members. We also have to protect and take care of access from outside sources. So especially any equipment that we have that is portable, laptops, cell phones, things like that. We should be encrypting the data on there. So if there is an outside access, that data and information is safe. And we do need to have a process in place where we can audit and see who's accessing what and when and how and where. And periodically run those audits to make sure that our system is safe and that outside sources are not having access to confidential information.
So true. And I think the access controls one is federal law. But what worries me, Brenda, is some of the practices that we've consulted with are allowing sharing of logins and passwords. And so,
Yes.
according to what we read, everyone should have a unique login and password because that's how you track what they're accessing or what they're doing in the system. But if you're allowing multiple people to use the same login, well, then how would we know that there's been an unauthorized access, especially if that individual leaves the practice and now that login and password remains the same because multiple people are using it. So that would be a worry that I would consider, especially that we've seen it.
And it's more common than you might think. We actually have worked with many practices where maybe the entire clinical team is using the same login and password because it's just easier for them to remember. So yeah, not only is it important that everyone should have an individualized, complex login and password, but you should be updating and changing those periodically as well. So you don't want to use the same login and password for 5 years. Once or twice a year, you should be updating those and changing those as another level of protection.
Yeah, good point. What about encryption?
Caitlin, do you want to jump on encryption?
Yeah, encryption is an important recognized security practice that can help protect your data at rest and when it's being transmitted. So, for example, an encrypted email service might help you to encrypt that data when you send it to, for example, another practice. We don't want that data to be intercepted by someone not authorized to view it. Now, encryption is listed as an addressable specification. However, if you're not going to use encryption, you do need to use an alternate method and explain why encryption was not feasible for your practice. So encryption really is preferable, and we do have new updates that may be coming into effect. And if they do go into effect, you will be required to encrypt your data at rest and in transit. So really, if you're not already doing this, essentially you need a good reason and an alternate method to protect that data.
Right. So easy answer is encrypt, right? I mean, it's so easy anymore. So Brenda, we've talked about the issue of doing a HIPAA security risk assessment. And the whole point is to identify vulnerabilities and threats to the data. But what happens when there is a breach? What is the process then?
Yes. So when there is a breach of your system, we are required to notify everyone who was affected by that breach within 60 days of that breach happening. And there are multiple steps taken with researching what the breach was, exactly what information was merged and utilized, how it happened, how their access was granted. And on the flip side of all that, once the breach notification has taken place, then you're required again to make sure that you're putting in the corrections within the system that allowed that breach notification to happen, and train your team and everyone involved with the practice protected health information so that it doesn't happen again.
And this is a very complex area, and I've represented clients who've had breaches, and I want to reiterate that it's 60 days from discovery. And so the actual cyber criminal may have been in the system months before.
Mm-hmm.
And then the date it's discovered is when the clock starts ticking. And I'll tell you, 60 days is not a lot of time, because by the time you employ forensics to figure out what happened, what data was exfiltrated, and what changes have to be made, and doing all of the reporting, patient notification, this is a huge task. Notifying media outlets, there's more than 500. So it's huge, and you are literally beating the clock to get this done in time. So really the best practice is to try to make sure this doesn't happen. So even though encryption is a pain, definitely need to make sure files are encrypted. Is there any other thoughts, Brenda, that you have on common violations?
Well, I think that's such a valuable point that you just made. You know, all of these tasks or requirements, everything involved with our HIPAA training and our policies can seem a little daunting because there are so many moving parts to HIPAA, and it's constantly changing as technology changes, as our offices change. So it is definitely a moving part machine to keep all your I's dotted and your T's crossed. But it's so important that you take the time to implement these systems, put them into place, make sure you're doing your audits to make sure that they're working properly, because the opposite end of it, should you have a breach, it's a very public process, and it's not something that is going to fare well in the public with your practice.
And we certainly don't want to dispose of information incorrectly. And we talked about that earlier. If it's legacy equipment, outdated computers that have hard drives, or copy machines that have data stored in it, or even paper records that have information on it. So we want to dispose of things correctly. So we sympathize, don't we, with practices, because this is a huge area of compliance that is time consuming and scary, because the levels of fines are thousands to millions of dollars.
Mm-hmm.
And I'm glad that we found some time to share the knowledge of Brenda and Caitlin and myself and what we are seeing day to day with our dental practices. So thanks again for tuning in to In Step with Compliance with the top HIPAA violations, and we look forward to seeing you and speaking with one another on future episodes.